Мое выступление...
Distinguished participants, my statement is to amplify the voices of indigenous peoples at this 25th session of the Permanent Forum, ensuring the health of indigenous peoples, including in times of conflict. The highest value of people is their life and their health. The health of indigenous peoples is not a question of vulnerability. It's a question of the systematic failure by states to shoulder their commitments for human rights. In accordance with the UN Declaration on the Rights of Indigenous Peoples and the International Covenant on Economic, Social, and Cultural Rights, states have obligations to ensure the rights of indigenous peoples to the highest attainable level of physical and mental health. This includes access to healthcare services and the acknowledgement of traditional practices. But in practice, we see this fall short. On the one hand, there are violations of the basic determinants of health, that is land, ecosystems, and healthy food. And we're also seeing a lack of medical care. That's particularly true in remote, hard-to-reach areas where indigenous peoples live. In many cases, the medical infrastructure is either lacking or falls short of, or it doesn't fit with the cultural and features of the population. This curtails access to preventive and treating care. And it also leads to other shortcomings. We urge the following urgent actions. States need to ensure accessible, adequate, and culturally appropriate medical care, including developing targeted programs for remote territories. This includes investment in mobile clinics, medical centers for indigenous peoples. It involves training medical workers coming from indigenous communities. And there's a need to scale up solutions in telemedicine as an efficient means of overcoming geographical isolation. International experience has shown that such models are successfully applied for diagnosis, consultation, and for accompanying patients in remote communities. And these methods can be adapted to the cultural context of indigenous peoples. There's a need for a legal recognition of traditional medicine, but there's still often no way to regulate those who have traditional knowledge, those who are traditional healers. This curtails access to health, but it also is a barrier to conveying knowledge between generations. We encourage states to develop legal and institutional mechanisms that will recognize and certify traditional medicine practices, this while respecting their systemic knowledge. They should also integrate traditional and biomedicine approaches based on a mutually respectful approach. They should protect traditional knowledge from inappropriate use. And there's a need to ensure the development and strengthening of accessible, long-term, adequate mechanisms to finance indigenous organizations. This includes simplifying procedures for reporting and for making applications. This means also immediate access to financial instruments without state intermediaries. Monitoring mechanisms should be developed that consider the priorities and approaches of indigenous peoples themselves while ensuring sustainable dissemination of resources. There should be allocation of special resources to indigenous leaders and human rights defenders that run the risk of violence, especially in the context of domestic violence. By way of conclusion, without recognition of the right to land, food, knowledge, and access to healthcare, it's impossible to ensure the rights of indigenous peoples to health and to life. It is high time to transition from declarations to responsibility, from projects to systemic solutions. Thank you.